Welcome, everybody. Welcome to the Onboarding for Contact Tracing training. This training is designed for community-based organizations that are going to be doing contact tracing as part of one of their bucket of work. So this is how you know you're in the right place. We suggest that you please watch the onboarding training before watching this one. That the general onboarding training will give you a great foundation in order to understand more of this grant and how it will work. This onboarding for contact tracing training is a step prior to the fundamentals training. So this will be the first step that you do before you take the full day fundamentals contact tracing training that will prepare you better in order to do contact tracing. This training, the onboarding for contact tracing training, is designed to just give you a foundation and give you a good basis for you to be able to go into the fundamentals contact tracing training more prepared. With this, we also want to let folks know that we are learning every day new things, and that this process would not be possible with you all. So this is a collaborative process. Please, if you have any feedback or any thoughts, please make sure to contact your community engagement coordinator so we can make sure that we're doing our best work in order to meet your needs. So welcome everybody. This is me. My name is Karina Guzman. My pronouns are she, her, and they. I am a community engagement coordinator for Region 2, which is Benton, Lynn, Lincoln, Marion, Polk, and Yamhill. This is our colleague, Palmira Veloz. Her pronouns are she, her, hers. She's a community engagement coordinator for Region 2.
And hi, everyone. I'm Danny Galvez, pronouns she, her, hers. I'll also be helping Karina present for this recording. I'm a community engagement coordinator as well, and I'm working with the Asian and Pacific Islander CBOs as well as some statewide CBOs.
So here's what we're going to talk about today throughout our presentation. We're going to start with OHA's acknowledgement to community. Then we're going to hop into your community engagement team so you're able to identify who those folks are. Then we're going to go into contact tracing terms and overview. Confidentiality and privacy will follow. And we're going to wrap with fundamentals contact tracing training overview. So we're going to begin with Oregon Health Authority's acknowledgement to communities. We are sharing this in order for you to, for us to ground our work and our values with community. So I'm going to go ahead and read them. We acknowledge there are institutional, systemic, and structural barriers that perpetuate inequity that have silenced the voices of communities over time. We are committed to partnership, co-creation, and co-ownership of solutions with communities disproportionately affected by health issues so that groups can actively participate in planning, implementing, and evaluating efforts to address the COVID-19 response and other health issues. We recognize community-engaged health improvement is a long-term and adapting process. We are striving to engage with communities through deliberate, structured, emerging, and best practice processes. We are striving to make engagement with public health effective for communities, especially those communities that experience institutional, systemic, and structural barriers. And here's how we're trying to do that work. It is an ongoing process. We are working on the co-creation and development of solutions by acknowledging that COVID-19 has impacted the health of Oregonians. And certainly none of us can address these challenges alone. We need to be working collaboratively. The COVID response team has been hosting listening sessions since March and having many conversations, and we hear you loud and clear. You are the expert of your community. And with that, we are using CARES Act funding to support community efforts like yours. So who do we serve? We serve Black, Indigenous, and people of color, people with disabilities, families, people who are houseless, individuals with substance use disorder, immigrant and refugee communities, faith communities, undocumented communities, farm workers, people experiencing mental health issues, older adults, and LGBTQIA+ communities. So this is our community engagement team. These are the folks that are assigned to a different region. If you've received email from some of these folks, you can put a face to the name. And we are currently in the process to hire another community engagement team, so it will be a total of 12 of us. And if you don't know who your community engagement coordinator is yet, this is a map that will help you identify, based on your region, who that person is. If you still have more questions of who that person is or how to reach them, please ask your lead supervisor or your supervisor so they can help you identify this person. We are here to support you in the process.
Okay, thank you, Karina, for that introduction to our work. So now that we have that foundation, we're gonna switch gears and just move into the contact tracing specific portion. And so these are 3 objectives that we want you all to leave this presentation with today. So the first is to get a general understanding of contact tracing terms. The second is to become familiar with how contact tracing is structured in Oregon. So just having a high-level understanding of how contact tracing works in the state, as well as where you all fit in as community-based organizations. And the third is an introduction to the fundamentals contact tracing training. So we'll just give a brief overview of the general format of that full day training, as well as instructions for how you can go about registering. And so before we jump into the rest of the presentation, we just wanted to show a quick overview of contact tracing. So this is a 1-minute video that the Oregon Health Authority created.
You may have heard the term contact tracing recently, and you're probably wondering what it is. Contact tracing means calling people who may have been exposed to someone who has tested positive for COVID-19. On the call, contact tracers provide information and support to people who have been exposed to COVID-19. It's a key tool for preventing the spread of the COVID-19 virus. In Oregon, local public health authorities, tribes, community-based organizations, and the Oregon Health Authority are working together to stop the spread of COVID-19 with a coordinated contact tracing effort. During a call, a local contact tracer will share information about symptoms to watch for, how to get tested if you get sick, how to prevent the spread of the virus, how to care for yourself and those in your household, and how to connect with resources in your community. Any information you share with a contact tracer will be kept confidential. To learn more about contact tracing, visit our website, healthoregon.org/contact tracing. Together, we can stop the spread of COVID-19 by answering the call.
Okay, so now that you guys had that brief overview of some of the things you'll be doing as a contact tracer and how and some of the tasks that you'll be doing, we're just gonna go over some of these general terms. So these terms you'll hear throughout this onboarding video and as well as during your work as a contact tracer. So the terms are LPHA, or Local Public Health Authority, case investigators, contact tracers, isolation, quarantine, and ARIAS, or the At-Risk Identification Alerting System. And next we'll go into each of these terms with a little more detail. So the first term is Local Public Health Authorities, or LPHAs. So LPHAs are the county level agencies carrying out public health programs and services. So these could be the county public health departments, or sometimes a county will contract out to another organization to complete their public health work. In either case, these can be generally referred to as LPHAs. And you'll hear this acronym pretty often throughout today's presentation because a lot of this contact tracing work will require collaboration between the different LPHAs. And the public health system as a whole in Oregon is carried out through a collaborative system that includes federal, state, and local agencies, as well as private organizations and communities. And so these different systems all work together in order to meet the needs for public health in Oregon, as well as to respond to COVID-19. And the next terms that we're going to go into is case investigation in contrast to contact tracing. And so this first term, case investigation, happens when someone tests positive for COVID-19. And so with that positive test, they're sometimes referred to as a case. And these positive cases are then asked to go into isolation. And we'll touch upon isolation in a couple of slides. So this case investigation process is completed by the LPHAs. Contact tracing, on the other hand, so this happens when someone has been in close contact with someone who has tested positive, but they have not tested positive themselves. So contact tracing is for folks who are told that they may have been exposed to COVID-19, but again, they don't have that positive test. And these people may or may not be showing symptoms. And contacts are asked to go into quarantine, which we'll also talk about next. This process is completed by either the LPHAs or you folks, the CBOs. So now we're going to go into the two terms that I briefly mentioned previously, isolation and quarantine. So isolation is the term that's used when you're having sick people be separated from healthy people. So it separates people who have tested positive for COVID-19 from people like their family or friends, and this is in order to prevent the disease from spreading. So people who are in isolation should stay home and separate themselves from others by staying in a separate bedroom or space and using a different bathroom when possible. It's also important to note that isolation can take place at home, but it can also take place in different spaces like a hospital or a hotel if it's not possible for a person to safely isolate at home. So quarantine is the next term, and this is related to contact tracing. So quarantine is for people who may have been in close contact with someone who has COVID-19. So it's used to keep someone who might have been exposed away from others to also prevent the spread. So someone in self-quarantine stays separated from others, limits their movement outside of their home or facility or where they're staying. And so when you're thinking of these terms that we just went over, it's really helpful to kind of repeat them to yourself and continue learning about them, because I know when I'm hearing about COVID-19, when I'm talking with friends and family, I hear these terms are used interchangeably often. And so you, as a contact tracer, it's important to know that case investigation is related to isolation and contact tracing is related to quarantine. And again, you'll be taking that full day fundamentals training. So you'll get this information repeated to you, you'll learn more about these different terms, and you'll also be able to build more of your skills for contact tracing around these terms during that full day training. Okay, so now that we went over those 4 general terms, we're going to talk about how contact tracing starts. So the first step occurs when someone tests positive for COVID-19. And so that positive test is what makes them become a case. And from there, case investigation is completed by the LPHA. So this is the process where the LPHA will talk to the person who tested positive, and they'll do sort of like an interview with them. And they'll gather their information, ask them how they're feeling and things like that. And they will store this information that they collect during the case investigation into a data system that's called OPERA. And we'll talk about this a little bit more later in this presentation. And so during that case investigation process is also where contacts are identified. So the case investigator will ask the person if they've been in close contact with anyone. And that's how we get this information. And that's how contact tracing starts. So once contacts are identified, contact tracing and symptom monitoring is completed by either the LPHA or the CBO. And this information is stored in a data system called ARIAS, which we'll also talk about later in the presentation. So just to provide an example of this process, let's say that I had started feeling sick. I had a sore throat and coughing and everything. And so I went to my doctor and I got tested for COVID. It turns out that my test came back positive. And so what that does is my information is then sent to the LPHA in order to conduct case investigation. So in my case, I'm in Multnomah County. So the Multnomah County Public Health Department will get my information. They'll give me a call to follow up, and they'll do that case investigation. And during those phone calls, they're going to be asking who I've been in close contact with. And so in my case, let's say maybe I went to a party with Karina and Palmita. And so that's what I'll tell the case investigator, and I'll provide the case investigator their names and contact information, whatever I have. And from there, that's where contact tracing starts. And so Karina and Palmita will both get a call from a contact tracer, and they'll be told that they may have been exposed to COVID, and then they'll go through that contact tracing interview process. And then part of contact tracing is also the daily symptom monitoring. So if you're identified as a contact, you'll be asked to go into quarantine. And during that quarantine period, you'll have someone checking up on you each day. And that's where the daily symptom monitoring comes into play. And so that's kind of the flow of how contact tracing starts. And again, you'll definitely receive more information about contact tracing and your role as a contact tracer when you take that full day fundamentals of contact tracing training. Okay, and so as you guys can tell from the previous slides, that collaboration really is key, especially as we're all coming together to deal with this pandemic. We're all needing to work together in order to meet the needs for the different communities in Oregon. So OHA, local public health authorities, and community-based organizations all have to work together for this COVID response, as well as specifically for contact tracing. And it's really so that we're able to help the different communities throughout our states. Okay, and you might also be asking, why are we bringing CBOs in? So you saw that the LPHAs are also doing contact tracing, and you might be wondering, so why are we bringing you folks, the CBOs, in now? And this is because you all are the experts in your community. You've probably worked with the community in the past, or you're a member of the community yourself. And so you have the community's trust, and you'll be able to better build relationships with the community members that you're helping. So that means that you'll know how to ask certain questions to get a response that would be most helpful for contact tracing. And you'll also be able to relate to these individuals and convey messages that are really important to get across as we're all trying to prevent COVID-19 from spreading. The LPHAs, on the other hand, may not have these same understandings of the different communities that we're working with. And so this is really where we want to pull in your expertise. This is especially important because we have seen that most impacted by COVID-19 are marginalized communities. So these are people of color, undocumented folks, people experiencing houselessness, people impacted by mental health or their addictions, among other communities. And this is where we want you to use your expertise and your lived experiences and bring that into your work as a contact tracer. So how will it work? How will it work with you folks, the CBOs, working with the LPHAs? So there are two general workflows that'll happen after the case investigation is done by the LPHA. So this right-hand side shows that in one case, the LPHA will do the interview for contact tracing. And after the interview, they'll say that they want to bring in the CBOs for support. And that's where the CBOs will do that daily symptom monitoring that I touched upon briefly earlier. On this left-hand side is a different workflow where the LPHA will identify that they need CBO support prior to them making the first contact. And reasons for this could be like language access. Maybe the community member speaks a language that the LPHAs can't meet, or they could be part of a particular community where they already have trust with a CBO. And in that case, they may also choose to bring in a CBO for this work. And if that's the case, then the contact tracing interview portion, as well as the symptom monitoring, will be done by the CBO. And so these are two general flows of work that can happen as you're working with your LPHAs. And this will look different depending on the counties that you're in. So each county or LPHA has their own system set up, and they're also seeing different needs depending on where outbreaks are occurring. So these two flows may look different, but these are generally the frameworks that we'll follow.
So now we're going to shift gears a little bit here and talk about the different data systems that are used to for COVID-19. We have two data systems. The first one is the Opera system, which is used specifically for case investigations by LPHAs. We just want you to know about the existence of the system, as you might hear it in conversation or by passing or by context. So this is just helpful to know that it exists, but this is not a data system that you will be using as a contact tracer. This is specifically for case investigation by LPHAs. Now we have the area system, which the area system, it stands for At-Risk Identification Alerting System. This is a web-based platform and is currently only available in English. This is the specific web-based platform used for contact tracing. As I mentioned earlier, it is currently only available in English, but it will soon, we will, in the next slide, we will be able to touch more based on how you can access it in different languages. So OHA has areas training and protocols in place for users. In all areas, users will need to complete a confidentiality and privacy trainings, and we will have more information about that coming soon. Areas use is spending for CBOs, but this is how you can utilize it for now. So we do have paper and PDF forms. So what this will look like is a PDF or a paper form that models the area system. You might be able to access the data system this way in English and Spanish and Russian and more language as identified soon. And we will have more information on how this data will work within your own community-based organization soon. So with that, we also need to talk about HIPAA and confidentiality, as we will be working with people's personal health information. So by definition, what is HIPAA? HIPAA is the Health Insurance Portability Accountability Act. It's a law that protects individuals' personal health information by requiring that certain privacy and security standards are met. All contact tracers will be dealing with personal health information, so must follow the security protocols in place. Since we are dealing with people's personal information, a memorandum of understanding, or you might have seen it as an MOU, will be created between each of the CBOs and LPHAs they're working with. An MOU is basically an agreement where both parties agree to keep individuals' personal information private and secure. Because privacy and confidentiality is a large concern, all contact tracers are also required to take a HIPAA and confidentiality training and watch a privacy video. This training will be completed online, and unfortunately at the moment it's only available in English. We're working on getting this translated and will also provide you with more information as it is finalized. The privacy talks are on YouTube and are available both in English and Spanish, and we will be able to direct you to those once they're ready. More information about the training and videos can be found on a handout available. Danny, can you let me know, will this handout will be available on the website as well?
Yeah, we can post this on the website too.
Great, thank you. So just for your context, this is a breakout activity that we had for our live sessions, our live trainings. And in this moment, this is when we would break out folks into rooms to answer some of these questions and be able to brainstorm in different teams. However, for your own context, these are some really important questions to think through as you start creating your own internal protocols and brainstorming on how to address this. So the first question is, what are some examples of potential privacy breaches that could happen within your CBO? What do you do if you know the person who has been identified as a contact? What are some concerns you have regarding privacy and confidentiality? Again, as you think through these questions, please make sure to loop in your community engagement coordinator if you need any support, or are there any ways that we can help you through these questions or more concerns that may arise. But to answer those questions and give you some guidance, here are the CBO privacy requirements that we have in place. So no personal devices are allowed. This means no personal cell phone, no personal computer. You will need to use your organization's provided cell phone or computer. Also, this is a great use for startup cost money in order to buy or to find your own devices for contact tracing. Another thing, please keep files in a secure place. With a lock or with a key, please make sure you lock them. Again, we are going to be working with people's private health information, and it is incredibly important that we follow all the privacy requirements and that we continue exercising these protocols in order to build trust within our communities and continue transparency as we respond to a health crisis. Lock computers and phones. If you're away from your computer, if you're away from your phone, please lock them. Use secure data system behind firewalls. Don't use Google Docs or Google Sheets. The area's platform that it is specific for contact tracing does have secure data systems. However, it is recommended for best practice that you have your own secure data system behind firewalls. And don't use Google Docs or Google Sheets. These are not private. This can be easily be shared, and this function under a cloud system. And lastly, do not share anyone's personal information with anyone outside of the public health effort. We understand that as we work directly with people in a health crisis and in a pandemic, that a lot of things might come up for folks, and these things will also come up for you as you process those emotions. But please do not share this personal information with your family or with your partner or with your neighbors. Please, we suggest that you create an internal protocol and an internal recommendation within your own CBO to find best ways to support your work and to find the best way to have supervision in order for you to be able to process your work and do better. So these are some concerns that we've heard from folks. So what if you know the person? The first step that we suggest is talk to your supervisor or your contact tracing lead in your organization. Your community engagement coordinator is here to support you as well, if you need any guidance or if you need support in the process. We encourage CBOs to establish an internal protocol around confidentiality and privacy. We understand that in some cases, it could also be a coworker that it is the person that you need to do contact tracing for. These things are going to happen within our communities, and we need to be prepared for that. So establish an internal protocol around what is this going to look like? Are we going to respond to these calls internally? Is this going to be referred to another community-based organization? How can we look back in the local public health department and the LPHA in order to make sure that we are respecting the person's privacy and in order to make sure that folks feel comfortable as they do contact tracing. And lastly, I want to highlight trust and communication. It is very important that we continue modeling trust and communication and transparency within our communities. Again, an example, it is following the protocols for privacy and confidentiality. It is very important that we model this within our communities, especially communities that have been historically hurt by different systems, that we need to, in the middle of a pandemic as well, we need to show up in a way that reflects trust, communication, and transparency. So what happens if there is a privacy breach? Contact your contact tracing lead or supervisor immediately. We know that things happen sometimes. We all are humans and we are not perfect. And we want to prevent any breaches from happening. But if there is an instance where there is a breach or even a potential breach, please let your contact tracing lead or supervisor know immediately. They will have to contact the LPHA and the community engagement coordinator as soon as possible to work out a potential solution. This process might look differently for every single CBO, but this is a standard or a model that we are sharing with you all. The full breach needs to be, from beginning to end, needs to be notified within the 14 hours of the event happening. So these are some contact tracing staffing needs. And again, this may look different for each CBO. So what it might look like is you have a contact tracing lead or a coordinator, you have your contact tracers, and once the area system access is provided to CBOs, a data entry person will be available if needed by your CBO. One thing that I want to add is, as previously as I mentioned, the area system is right now only available in English. You can access paper forms in other languages. However, if you do happen to work in an organization where there are monolingual speakers that may be able to, monolingual speakers other than English, that might be able to do contact tracer in another language than English, then you will need someone that is bilingual in those two languages to enter all the data from those forms into the system. And we suggest that you need to have a staff on call 7 days a week. 7 days means someone on call for a shift. This is given the need that might come up for contact tracing. You have 20, and this also comes from, you have 24 hours to connect the contact once assigned by the LPHA. More information on this will also be found in the Fundamentals Contact Tracing training.
Okay, so now we're gonna kind of wrap up this session with an overview of that full day Fundamentals Contact Tracing training. So this training is conducted by the OHA Active Surveillance Training Team. So this is a group outside of your community engagement team, and you'll be working with them to get your registration and materials in place. It's a full day training. It runs from 9 to 4, and there are breaks and lunch included in that time. It's currently being held on Wednesdays and Fridays in English and Wednesdays in Spanish. It's also being held on Zoom and will include a mix of presentations and interactive practice sessions. So you all will be able to practice with the scripts and do some breakout sessions with each other. Because it's being held on Zoom, there are technology needs. So you definitely need stable internet for the 7 hours. And we would also recommend that if you don't have Zoom already, then to download it onto your computer ahead of time, which can also help with the connectivity. We also encourage you to use your camera while you're doing the group work. It's really helpful to be able to see the other person that you're talking to as you're going through scripts and kind of going through different scenarios. And we also recommend using a microphone or headset if possible, just to get the best quality for audio and voice. If you need to test your computer's compatibility with Zoom, you can go to this web link here that's provided, zoom.us/test. And there you can see if your audio as well as camera works for Zoom. Okay, so fundamentals registration. So since this training is held by a group separate from ours, there is kind of an additional step that needs to take place. And we're asking that CBOs send your CEC a list of the staff who will take this fundamentals training. And that list should include the date of training, the person's name, email, their language that they're going to take the training in, so English or Spanish, and then if any accommodations are needed. Once your CEC gets this list, they'll submit it to the active surveillance training team, and then each staff member will get a registration link. It'll be a Zoom registration link. From there, each person will have to register, and please keep in mind that registration does close at 3 p.m. the day before. Also, we are onboarding a good amount of community-based organizations. So if you register early, that'll also help to ensure that you have a spot because space is limited. So once you submit your registration, you'll get the Zoom link that'll be used to join the training, as well as the training materials. And this information will also be provided in a PDF as a resource document for you folks to refer to, which is this. So this is our contact tracing checklist. This will also be available in PDF form, as I just mentioned. So it goes over the different things that are required for each of the contact tracers. So there's the general onboarding video, this contact tracing onboarding training that you're joining us now, the fundamentals full day training, and then the two requirements on the bottom are the requirements for the HIPAA and confidentiality training. So this privacy and security recording will be available on YouTube. It's not available yet, it's still being developed. So we will make sure that we let everyone know once it does become available, as well as upload it to our website and update this PDF. And then the last one is the information security and awareness privacy training, which has instructions below for how to take the training and register. This is a list for resources for you as a contact tracer. So there's this first training, Making Contact, a training for COVID-19 contact tracers, as well as OHA websites and CDC websites. That's really helpful. I know when I first started to do this work as a community engagement coordinator, as well as starting to learn about COVID-19, there was a lot of information out there. So these resources will be really helpful in conveying that information, and which will help as you're doing your work as a contact tracer, because you will be talking to community members who may have a lot of questions for you. And this is the training that I just mentioned, the Making Contact, a training for COVID-19 contact tracers. So this is an online training that we're also recommending. It's put on by this ASTO, Association of State and Health Territorial Health Officials. So it's an online training that'll give you a really good base for your work as a contact tracer. And it's especially important if you haven't worked in public health before. This will give you some really good information. And so we're highly recommending this training. And of course, if you ever need help, your community engagement coordinator is there for you. Please reach out to us if you ever get stuck with something, or you ever have any questions, and we'll do our best to try to find a solution for you. So thank you everyone for joining this presentation today. We hope this was helpful in getting you onboarded to do contact tracing. And again, please let us know if you do have any questions.